Hi, my name is Muhammad Umar Al-Muiz bin Muhammad Zain, the presenter of this group, and as stated below, that are my group members, Mina, Michelle, Arif, Muhammad, Munisha, Natia, Namesh, Eng Joy Chun, and Nitya. So the hottest topic today that we gonna discuss is about HIV infection. Let's go. So before we go any deeper, firstly, we are looking at the epidemiology of HIV. HIV, human immunodeficiency virus, is a virus that attacks cells that help the body fight infection. It is a unique type of virus, retrovirus. There is no cure, but it can be treated with medicine. HIV invades the helper T cell to replicate itself, causes progressive failure of the immune system, making the body far more susceptible to infections and cancer. HIV develops into acquired immunodeficiency syndrome, which is known as AIDS. There were approximately 37.9 million people across the globe with HIV in 2018. Of these, 36.2 million were adults and 1.7 million were children, which is less than 15 years old. Approximately 79% of people with HIV globally know their HIV status in 2018. The remaining 21%, about 8.1 million people, still need access to HIV testing services. HIV testing is an essential gateway to HIV prevention, treatment, care, and support services. Now we are moving to look at the morphology of HIV. HIV is a member of the genus Lentivirus, part of the family Retroviridae. Many viruses in this family are responsible for chronic illness with a long incubation period. HIV is different in structure from other retroviruses. It is roughly spherical with a diameter of about 120 nanometer, around 60 times smaller than a red blood cell. It is composed of two copies of positive sense single-stranded RNA that codes for the virus 9 genes, enclosed by a conical capsid composed of 2000 copies of the viral protein P24. The single-stranded RNA is tightly bound to nucleocapsid proteins P7 and enzymes needed for the development of the virus, such as reverse transcriptase, protease, ribonuclease, and integrase. The envelope protein encoded by the HIV envelope gene allows the virus to attach to target cells and fills the viral envelope with the target cell's membrane, releasing the viral contents into the cell and initiating the infectious cycle. This is the HIV structure. We can see the glycosylation, capsid, nucleocapsid, viral RNA genome, integrase, reverse transcriptase, protease, the lipid membrane, the matrix protein, the protein of host cell, and the envelope glycoprotein complex. Now we are going to look at the mode of transmission. Transmission of HIV. The person-to-person spread of HIV is called HIV transmission. People can get or transmit HIV only through specific activities, such as through sex or injection drug use. HIV can be transmitted only in certain body fluids from a person who has HIV, which are blood, semen, and etc. So how does this transmission actually works? HIV transmission is only possible if these fluids come in contact with a mucous membrane or damaged tissue or are directly injected into the bloodstream from a needle or syringe. Mucous membranes are found inside the rectum, the vagina, the opening of the penis, and the mouth. So the most common way, having anal or vaginal sex with someone who has HIV without using a condom or taking medicine to prevent or treat HIV. Sharing injection drug equipment such as needles with someone who has HIV. So by these two actions, the transmission of HIV can be conducted. So this is the less common ways. HIV can also spread from a woman with HIV to her child during pregnancy, childbirth, also called labor and delivery or breastfeeding. This is called mother-to-child transmission of HIV. Getting stuck with an HIV contaminated needle or other sharp object. This is a risk mainly for healthcare workers. The risk is very low anyway. So this is the extremely rare ways having oral sex, but in general, the chance that an HIV negative person will get HIV from oral sex with an HIV positive partner is extremely low. Receiving blood transfusion, blood products, or organ transplants that are contaminated with HIV, the risk is extremely small these days because of rigorous testing of the US blood supply and donated organs and tissues. Being bitten by a person with HIV, each of the very small number of documented cases has involved severe trauma with extensive tissue damage and the presence of blood. There is no risk of transmission if the skin is not broken. Contact between broken skin, wounds or mucous membranes and HIV-infected blood or blood-contaminated body fluids. Deep, open-mouth kissing if both partners have sores or bleeding gums and blood from the HIV-positive partner gets into the bloodstream of the HIV-negative partner. HIV is not spread through saliva. Eating food that has been pre-chewed by a person with HIV. The contamination occurs when infected blood from a caregiver's mouth mixes with food while chewing. The only known cases are among infants. Here we are to look about the clinical features causes from HIV. There are three stages of HIV. Stage 1, acute HIV infection symptoms. Stage 2, clinical latency symptoms. And stage 3, AIDS symptoms. As for the stage 1 acute HIV infection symptoms, within 2 to 4 weeks after infections with HIV, person may develop symptoms such as fever, chills, rash, night sweats, muscle ache, sore throat, fatigue, swollen lymph nodes, and mouth ulcers. Now for the stage 2 clinical latency symptoms. In this stage, the virus still multiplies but at very low levels. During this stage, untreated HIV will kill CD4 cells and destroy our immune system. Without treatment, the number 4 of CD4 cells will drop and we will be more likely to get other infections. People in this stage may not feel sick or have any symptoms. This stage is also called chronic HIV infection. And the last stage is stage 3, AIDS symptom. AIDS is the advanced stage of HIV infection. CD4 T cell number drops below 200 and our immune system is badly damaged. Symptoms of AIDS can include rapid weight loss, recurring fever or profuse night sweats. Diarrhea that lasts for more than a week, sores of the mouth, anus or genitals, pneumonia, red, brown, pink or purplish blotches on or under the skin or inside the mouth, nose or eyelids, memory loss, depression and other neurologic disorders. So now we are going to see the last part, which is the laboratory diagnosis of HIV. Tests for HIV infection are performed to identify those with the infection so that antiviral drug therapy can be initiated. To identify carriers who may transmit infection to others, specifically blood or organ donors, pregnant women and sex partners. To follow the cause of disease and confirm the diagnosis of AIDS. To evaluate the efficacy of treatment. First laboratory diagnosis is oral quick. The sample is oral swab, a rapid screening immunoassay for HIV antibody that can be done at home. Positive result needs confirmation by Western blot due to some false positive tests with oral specimens and dried blood. So here are some steps for using oral quick. Firstly, HIV antibodies from oral fluid are collected through the swab. Once the device is inserted into the test tube, the oral fluid mixes with the liquid and travels up the test tube. If C-line turns dark, It confirms the test is working properly. If no C line appears, the test is not working. If only C line appears, the test is negative. HIV antibodies collecting at the T line indicate the test is positive. The second diagnosis is by PCR-based assays, nucleic acid amplification test. PCR emerged as one of the most powerful tools for the amplification of genes and their RNA transcripts. Determine the amount of viral RNA in the plasma. Amount of viral RNA is used to guide treatment decisions and predict risk of progression to AIDS. The advantage is the sensitivity and specificity is 97% to 98%. The third laboratory diagnosis is combination, which come from the word combo test, for diagnosis of early HIV-1 and HIV-2 infection. And also P24 antigen is typically detectable earlier in infection than antibody. From this data, the time of appearance of HIV RNA, HIV P24 antigen, and HIV antibody is clearly stated. Note that HIV RNA in the plasma is the earliest laboratory finding, followed by P24 antigen. Antibody to HIV is the last to become detectable. Laboratory tests of HIV from serum or plasma. New algorithm CDC. So here are some prevention and control that we can take to avoid HIV disease. Prevention and control of HIV transmission. Point number 1. Abstaining from high-risk sex or practice of safe sex behaviors like using condoms. Point 2. Getting tested and treated for sexually transmitted infections, including HIV. Point 3. Avoiding injecting drugs, or if someone does, should always use new and disposable needles and syringe. Point 3. Ensuring safe blood. These are for the prevention and control of AIDS. Point 1. Elimination of reservoir by antiretroviral treatment. Point 2. Reduce HIV-related morbidity and improve quality of life and delay onset of AIDS. Point 3. Treatment of AIDS is lifelong but not curative but supportive. Point 4. Maximally suppress viral load and restore and preserve immunological functions. Point 5. Prevent vertical HIV transmission. Point 6. Newer regimens are potent, durable, less toxic, and have simplified regimens. Point 7. Non-nucleoside reverse transcriptase inhibitors, protease inhibitors, nucleoside analogues are being used. So that's all in my slides. For more details and information, these are the references that might help you. Thank you.